Welcome, welcome, welcome to the Green Nurse Podcast, where we bring hope and inspiration for growth and healing. We are truly here to change the dialogue and stigma around what it means to feel good and be high. And you've heard me say it once, and I'm going to say it probably till the day I die. We need to change the stigma and dialogue around that word high, right? So I invite you to think of this an acronym. H is for hope, I is for inspiration, G is for growth, and H is for healing. And here's a little bit about what we do in the industry as cannabis nurses and how we're changing the paradigm of healthcare, teaching on the endocannabinoid system. We are truly change agents and advocates for the evolution of cannabis and other plant medicines. So here's a little video that I want to share with you all, and then we'll get started.
We changed the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship. And what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare and us paving the way into a new vanguard of medicine. And I'm excited to really bring this into light. There's a company called Canam that we're merging with, and we will now be doing global education.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
And it's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers.
You're muted for some reason.
I'm muted for some reason. Well, what do you know? Glitch
Now
here,
you're
glitch
not.
there. All right. Peace begins with me. Inhale, Ananda. So welcome everyone to the Green Nurse Podcast. My name is Sherri, and I'm the Vice President of Nursing at Holistic Caring and the Green Nurse. And not only am I a registered nurse, but I'm also a cannabis nurse, patient, advocate, activist, and a passionate podcaster here to share the love of plant medicine and all of its benefits. So today's special guest is a cannabis nurse and a cannabis patient, Deb Despain, or as we call her, Nurse Deb. Deb's been a registered nurse for 37 years, working in the conventional system as an emergency room nurse, as well as a workers' compensation case manager nurse. Deb developed stage 4 thyroid cancer and started using cannabis as medicine. And she's been using cannabis for the past 6 years since her diagnosis. So tonight's show, we're going to talk about what happened, how she got started into cannabis, how it's helped her, and what happened when she was recently admitted to the hospital with a hypertension crisis, and how the conventional system could have done better if they had clinicians who understood the endocannabinoid system and cannabis as medicine. My big message is, as clinicians, we need to truly stop traumatizing our patients and start being accountable to them by learning about this plant and understanding that cannabinoid therapeutics is much more than just cannabis. So if you're a nurse, I'm going to start plugging this right away. If you're a nurse or a health professional, we want you to join us in our free community. We have a free community, free introduction to cannabis course, free patient portal, support group, webcast, podcasts, and practitioners across the globe for you all to learn. So very, very important. This topic is so special to me because we do see patients all the time that are being traumatized by pills and procedures, and they have nowhere to turn. And if the doctors and clinicians knew about the endocannabinoid system, things might look a little bit different. So welcome, Deb. I am so happy to have you here today. We have a lot to talk about. I'm just so honored to have met you. I mean, we met for the first time last year. And when we started doing, we did retreats, Green Nurse Energized Living retreats with Denise, one of our nurses.
It was amazing.
Yeah. So just for our viewers, what was that like for you to go on a weekend long retreat with nurses?
Sherri, just being immersed in nothing but cannabis education and and different people's stories. It was nurses and our significant others, and we learned so much from each other and from you, and explaining our endocannabinoid system as an umbrella that I will always remember. Such a beautiful experience. The food was amazing, all CBD infused, and we could choose the amount of THC if we wanted to add it to our food. So we had an amazing experience. It was wonderful.
I'm so glad. And it's important. I mean, because you think about as clinicians, Deb, right? So in nursing school, what do? We go to nursing school, we sit in a classroom, we get theory, we get clinical, slides and presentations and all kinds of information, but that's information. And what we need to do is, how do we apply it clinically? How do we work with people in real life? And so oftentimes in my experience, and specifically doing these specific retreats, these energized living green nurse retreats, it teaches people how to embody plant medicine, how to get in touch with their smart body, how to pay attention. And these experiential retreats actually help patients to feel comfortable in their own skin, working with the various products, working with the different methods of administration, and how you can pair it with other health and wellness activities to create an experience to do what? To have a better quality of life. Right?
Absolutely.
Right.
And the other things that, stimulate our endocannabinoid system that we don't necessarily talk about, but is so important.
So important. So your journey, is very, very unique. You have an amazing story, and and I think this is things that we need to really tap into as cannabis nurses. We feel comfortable talking about things that people don't want to talk about, and this is one of them. This is truly one of them. So Deb, why don't you share with our viewers what brought you into cannabis? How did you start using cannabis as medicine?
Well, as a teenager, I experimented with cannabis for a couple of years. Before I went to nursing school, I did have anxiety and some depression as a teenager. And I was sent to the conventional psychiatrist and tried that medicine, and it was horrible, horrible, awful. And I experimented with cannabis, and it worked amazingly. I decided I wanted to go to nursing school and knew that I wouldn't be able to pass drug screens. So I opted not to use cannabis anymore. And for many, many years, never used it until I developed cannabis about 7 years ago. So I knew immediately when I developed cancer that I wanted to use cannabis as part of my treatment if it wasn't contraindicated. So I began to study and research and not necessarily shy away from our conventional system, because I did need surgery. I did need the tumor removed. I thought radioactive iodine was appropriate at the time. And then I knew I wanted to use cannabis. And my issue all along is I've never been able to take enough thyroid hormone to keep my thyroglobulin numbers high enough to keep my cancer at bay. So all these little cells that are still around there, just waiting to come out, do every so often.
Could
And
you
when they
explain, yeah,
do,
we explain that to our viewers so they kind of understand. So, so in other words, you can't take enough thyroid medicine to keep your cancer markers down. So what does that mean?
well,
Our viewers can
if I was
understand.
able to take enough levothyroxine or a type of thyroid, it would keep my thyroglobulin numbers low.
Right.
And when I take the proper amount of dose that would keep me safe from my cancer coming back, or much better option, my blood pressure goes up and my body doesn't rid of the thyroid hormone. So I become overdosed on it. And then they have to take me completely off of it, let me crash, which means you have zero energy, and build me back up. I've been on, as far as I know, the last thyroid medicine that there is out there, and my body still doesn't tolerate it well enough to give me a normal lifestyle. I don't have energy. If I took enough levothyroxine to get my energy levels up at what a normal person would be, my blood pressure would be stroke level, which has recently happened to me. I've had a stroke, I've had a seizure, I was ventilated and essentially died. So I fight the repercussions of what cancer causes me all the time with my blood pressure. And thank goodness for an amazing endocrinologist who believed in me and was willing to understand the endocannabinoid system and cannabis and what it would do. When I met him, and he said, let's learn. And, from that point, I've never been able to take enough medicine. So it wouldn't kill my cancer. My thyroglobulin numbers came up very, very high recently. And I went back on FICO, full extract cannabis oil. It was developed by a gentleman called Rick Simpson, and some of us still call it Rick Simpson oil, but it's made a little different, a little healthier. And in many different kind of cancers, and as I've learned as a cannabis nurse, it causes the cancer cells basically to turn on themselves and kill themselves. Yeah. For a lack of a better complicated answer, that's really simply what happens. Yeah. And because those cancer cells still linger around, I know they're going to come back, and they do. So I try to take a maintenance dose of RSO. I will admit I'm always not perfect at that, but when my numbers go back up, then I go back on my protocol of cannabis oil again. So it's my lifesaver. It's really saved me at least for 6 or 7 years because there is nothing else.
Yeah. Well, it's interesting, the Rick Simpson oil, Rick Simpson, there's a huge website on him, Phoenix Tears, creating the oil, how they created it. It's very, very high concentrated THC oil. They extract it in ethanol or food grade alcohol. It's called Rick Simpson oil because Rick Simpson was the man that treated his skin cancer, his melanoma, with it. And now, the way they extracted it was using a specific type of naphtha type of alcohol, which isn't safe for consumption. But now what they're doing is they're creating it a little bit different using food grain alcohol, Everclear, to extract the oil. And so you extract all of the cannabinoids in this alcohol, they cook off the alcohol, and then you're left with this very, very thick tar that they put up into a syringe. And sometimes a gram of that oil could test at 60. I've seen as high as 80% THC, which means in that gram of oil, it's almost 800 milligrams of THC. So it's very, very high dose THC.
Yes.
And so, it's in it, you have to be very careful, when you're taking it. And so we always recommend patients that have cancer to work with a clinician, to help them to navigate it. And so you were self-taught, and which most of us nurses are, because there were no clinicians around back when we started using this that were able to teach us how to use it effectively.
Right.
So the Rick Simpson oil you have found to be very helpful.
Absolutely. It is no doubt what causes my cancer cells to turn on themselves and die, because my thyroglobulin numbers go up, and a protocol of FICO, and my numbers go back down.
There you go.
So, I mean,
So how do you use the full extract cannabis oil? So when you're using it, do you use it? A lot of people will, put it on a cracker. They'll put it in a capsule. Some people will make drops out of it. How do you take it? How do you consume it?
well, typically what I do is I make my own. Behind me, I have a green oil machine. I use it the way you were talking about, with 190 proof Everclear, and it's basically a still. I do a quick wash, freeze the cannabis, and leave it in there for a few minutes, not to get a lot of the green. I lost my train of thought.
Chlorophyll.
Chlorophyll.
So you don't.
Yeah,
Yep.
the chlorophyll in there, which bothers my stomach. So then you just cook it down in the still, basically. And what you're left with is a black tar. And you can suck that up in a syringe. And what I typically do is take about an amount of a ungrained cooked of rice, put it on a toothpick, put that toothpick underneath my tongue, and let it absorb in my tongue. Now, I'm one of the unique people that do not get high from edibles. So
you can
Rick
tolerate
Simpson's-
high doses.
Yeah, it doesn't make me high at all, which a lot of people would have to go to bed and not be
Right.
able to work and function. Well,
Right.
whatever, there's, I believe, about 30% of the people that
People
are not able to, I guess, ingest.
feel the effects, the psychoactive effects
Yes.
of consuming cannabis. So some people will consume cannabis, they'll ingest it. We know that delta 9 in our digestive tract converts to delta 11 THC, and we know that the psychoactivity increases. It can be a lot more impairing, right? But what Deb's saying is that her body doesn't process and metabolize the same way. So she's able to tolerate the high doses of the full extract cannabis oil without being impaired, right?
That's exactly right.
And then when we're working with patients that are taking full extract cannabis oil, we like them to start in the evening at the nighttime, and we like them to build up tolerance, right? Because oftentimes, people don't want to be impaired. The goal of using medical cannabis is to do what? Is to feel good, is to manage symptoms below the threshold of being impaired.
Absolutely.
And so there is a safe way to dial up on that high dose of THC. And we, like I said, we recommend that you work with a clinician, and Nurse Deb is really good at it. So obviously, you've been doing a great job managing.
As you know, when we are patients, we become expert because you have to study and treat yourself. And now we have an amazing group of people with your organization, and I know you're going to talk about some upcoming events, but an amazing group of people that are educators, and the Cannabis Science Conference we all attended recently. The information is fabulous. I mean, it's something new probably every minute that we're learning.
That's what I say, Deb. The more I learn, the more I realize I don't know.
That's exactly right.
And once you go down that rabbit hole, there is no going back. It just continues and continues and continues. And I've heard some clinicians say, oh, we're just scratching the tip of the iceberg. Well, I say we're just standing on it. We're standing on the tip. We haven't started scratching yet, right? Because it's constantly evolving. Research is evolving. Laws are, everything is changing every day. And that's what's so exciting about
it. Is
cannabis
exciting.
medicine. Yeah. So let's talk about what happened, how you got into the space. I really love the story that we were talking about before, is that, you were working as an occupational health nurse, and you told your employer you wanted to become a cannabis nurse.
That's
I think
exactly
that was amazing.
right.
So tell us that story. I think it's a great story.
Well, I'm going to light up. Just 1 second.
Okay. Cannabis is medicine, y'all. Peace begins with me. Inhale.
That's exactly
Ananda.
right. So Tell me exactly how you asked the question, Sherri. I'm sorry.
So what I loved, we had a story how you went to your employer. So you were working as an
Yes.
occupational health nurse,
Yes.
and you told your employer that you wanted to become a cannabis nurse and do that in conjunction with your current job, which I found very fascinating and very brave. So how did that conversation go?
So, I had decided I wanted to go to my first nursing cannabis conference, and I wanted to make sure it would not cause any issues with my employer. And I said, I want to be able to use cannabis as a patient with cancer, and I want to learn more about it, and I want to be an educator. And I want to take my vacation and go do this, and I want to make sure it won't cause any problems with my work. And she said, absolutely not. I believe she talked to some upper management, and it never, ever, ever caused an issue. And then, interestingly enough, about a year or two later, at that same wonderful employer, they quit testing for THC. They realized that they were such a global company and all over the world. There are so many countries that it's legal. There's so many states it's legal. So they stopped even testing for it, which I was thrilled about. You can come to work with THC in your body and not be impaired.
Exactly.
We know that. Everybody just doesn't know that.
They don't. Well, it is. People don't know what they don't know, and they don't know that they don't know it.
Right.
So really, this is a great opportunity to educate. Go ahead.
Yeah, I left that job, and where I currently am today, on my interview, I said I'm a cannabis nurse. I'm not employed anywhere. I do this volunteer. I want to make sure you don't have any issues with it. And the lady hiring me said, no, but I have a lot of questions, and I have a friend who's going to want to know a whole lot about what you know. Yeah. So that was still never an issue. And I live in an illegal state. But
did you hear that, y'all? Illegal state. I can't even believe that it's still illegal. In so many states here in the United States, it's still a jaw drop for me. I'm like, what?
It's just crazy, Sherri. I can drive an hour and a half to Illinois and get the medication I need. And it's so unfair. Our wonderful Governor Beshear did develop a task force, and I have spoken in front of them recently and on the news recently about cannabis and how Kentucky needs it legal for all the reasons we know, for patients, for health, for people that are in jail for selling marijuana. They're healers. They're not.
Yeah, they were my healers. The people that are in jail are the ones that healed me, for sure. And that's why I have a huge, seriously, because if it wasn't for the grassroots movement, I wouldn't be here today as a cannabis nurse doing this podcast teaching. Right? I would probably be 6 feet under myself. Seriously, that's how sick I was at one point in time. So really, we have an obligation. If you're out there, if you're a doctor, if you're a nurse, if you're a clinician, you really do have an obligation to learn about the endocannabinoid system. It's just because you didn't learn it doesn't mean that it doesn't exist. Number one. Number two, it has been studied. It has been researched. There's a ton of research out there. We just need to learn how to apply it and how to integrate it into the conventional system in our care clinics as well. If patients have questions, we need to be able to ask them. And one of the things I'm always saying to doctors and clinicians is, do you have a knowledge of all the therapies, treatments, and procedures and pills that you're prescribing to your patients? Do you know whether they support the endocannabinoid system or not? And if they don't support the endocannabinoid system, what are you going to do to mitigate? What? So if you're prescribing therapies, right? And we know prescribing is what happens, pills and procedures. However, and I'm not anti-pharma and I'm not anti-procedures, but it's really, really important that if you're going to be doing something, that you do it for the right reason, and you educate the patients on the side effects and what they can do to mitigate side effects.
Absolutely.
Yeah. So what happened? This is a story that I want to share because some of this has happened to me. Like I said, I am a registered nurse. I'm a cannabis patient, registered nurse first, cannabis patient second, and then became a cannabis nurse. So I have had to deal with bias, with prejudice, with judgment, And it's been really, really hard. And that's probably one of the main reasons why I do this, is because it just really breaks my heart to see how we're traumatizing patients in the conventional system. We
I
go
know.
into healthcare. We go into healthcare as health professionals to do what? To do no harm, number one, and to help patients live a better quality of life with whatever is going on. And of course, as clinicians, we want them to heal. We want them to feel better. But what we're missing is that connection to them and understanding and trying to see behind their eyes in what they're going through, and also providing all options of care. So you had an unfortunate incident where you went into a hypertension crisis. You had a stroke earlier this year.
Yes.
Post-stroke, you went into a hypertensive crisis.
My pulse was in the 40s, and my blood pressure was extremely high. It was 310 over 190. And, it was just vacillating back and forth with just stroke level numbers. And so I went to the emergency department. I've just had some crazy situations. My first stroke, they never could get the pharmacy straightened out and ever give me any medicine for my blood pressure. So my second time, I choose to go to a different hospital. I go there, and everything seems normal in the beginning. I always disclose that I'm a cannabis patient, because I think it's very important that they know. And they gave me a drug called, well, I just went blank, Sherri, sorry.
That's okay. That's okay. It was
a blood
blood
pressure medication.
and there's a lot of them.
And I had a very bad reaction to it. I started vomiting, cramping all over my body. I was diaphoretic. I was sick. I was having a feeling of impending doom. I knew I wasn't going to live through it. I asked them to call my children. It was horrible. I started feeling just a little better. The doctor walks in and says, well, your blood pressure's doing well now. Probably better than mine. I guess we can send you home. And the medicine I had had a horrible reaction to. I just didn't react very well to that. I ripped my IV out, and tried to leave the hospital. And they brought me back in, and with another discussion, kept me in the hospital. My blood pressure immediately went right back up. My pulse was about 130, went from in the 30s and 40s to that. Blood pressure was just crazy. And I was admitted, and but I felt like I was going to have a seizure, and I was still having an allergic reaction. And
to the medication, to the
Mhm.
antihypertensive medication that they gave you.
Yes. And I had two friends there with me, and I kept saying, I'm not going to live through this. Please, somebody get my children, and please, somebody get me some help. I'm not going to live through this. There's a feeling that you just know. And one of my friends had left, and the other friend was still there. And all of a sudden, I felt myself dying and said, help. And I had a seizure and coded. And
Deb, for
I
the new
woke.
people, a lot of new people don't know what coded means. So I'll just kind of explain it to them. So
I
in the
quit
hospital,
breathing, and
quit breathing.
I believe my heart stopped. I had multiple bruises all over me, where they had restarted my heart and breathing. And I was on a ventilator to breathe for me, and kept in a semi-coma, while they still gave me this medicine that I was allergic to, but kept me sedated.
So you were allergic to a medication that you had a violent reaction to. You coded, which means you stopped breathing. They had to do CPR. They had to put a breathing tube in you, sedated you, paralyzed you to keep you not moving. And they continued to give you this pharmaceutical that you were allergic to, which continued to provide cause side effects, right? You started having nausea and vomiting.
Begging for Phenergan. All old nurses know what Phenergan is. It's an amazing drug for nausea and vomiting. They no longer give it IV. I was asking for, please give me Phenergan, Zofran. They had given me Zofran, and it didn't work. And they brought me some kind of Phenergan topical to rub on my wrist. I said, no, Phenergan. Can't give it to you IV. Shot, an intramuscular injection. Please give me Phenergan. Never gave me Phenergan, I don't believe, until the next to the last day before I went home. And I'd already been extubated by then. It was awful, Sherri. I remember people coming up to me, and they were not mean. They were kind, and they said, well, let's back up. Okay. They called the police when I coded.
That's what I wanted
to go through my bag. My beautiful bag with a marijuana leaf on it that I got at our cannabis conference had my vaporizer in it and all of my medicines, because my last hospitalization, they couldn't get my medicine straight. So I got no medicine except what I had in my purse. So I also didn't want to go without my cannabis. So I had my vaporizer with me in my purse. And they decided, for whatever reason, when I coded, to go through my purse, called the police and asked my friend, what is all of this? And my friend was, taken back by that and didn't really know what to say, and tried to explain what it was the best they could, which wasn't to say, this is her cancer medicine. This is her RSO. It's black. It looks a little scary maybe, but it's black cannabis oil. It's not scary. This is what she does with it. She uses it when she's on her protocol for cancer, and everything else is just cannabis. So they took it, and I've never actually asked for it back. I was still too sick when I was discharged to ask for it. I think I will. I believe I paid for it. It might be mine. But they came up to me and said, we know you have cannabis overuse syndrome. Now, Sherri, I'm so sick. I can barely say words, not sentences. I mean, I'm vomiting. I went through hundreds of emesis basins, which you vomit in. And I said, no. And she said, the oil. I said, no, I didn't come in vomiting. You're causing my vomiting. I didn't come in with cannabis overuse syndrome.
Well, see, what they're thinking of is, because what they're seeing a lot in the emergency room, and this is the part that's interesting. I've done a show on it, cannabis hyperemesis syndrome. It is a real thing. However, it is a real thing that happens over time. Just because someone throws up from using cannabis does not mean that they have cannabis hyperemesis syndrome or they're abusing cannabis. They may have taken too much, and there is a physiological response if you take too much. Cannabis is biphasic. So cannabis can work on nausea at specific doses. And if you take too much, it can make you throw up. But the reason why Deb was throwing up wasn't because of the cannabis. It was because she had hypertension and she was given a medication that she was allergic to. And what they tried to do was turn it around and make it about the cannabis. To do what? And to not be accountable for what they did. And they wouldn't let it go. That makes it even worse.
It was abusive. Sherri, it was literally abusive. It was horrible. I've never felt like that in my life. To go in and know what I know as a nurse, with the experience that I have, with vast knowledge of different specialties that I've been in, and the length of time that I've been studying cannabis. And like we said, we don't know everything, but my goodness, we're open to learning everything and absorbing everything we can. And I knew that I didn't have cannabis emesis.
Cannabis hyperemesis, yeah.
Yes, absolutely. or I would have had that at home, you know.
Exactly. You would have, and cannabis hyperemesis, syndrome actually happens over a period of time. It doesn't happen immediately. And it's, you have to look at, there's cyclic vomiting syndrome, cannabis hyperemesis syndrome. So you look at different physiological components. Cannabis hyperemesis syndrome is delayed gastric emptying, where cyclic vomiting syndrome is prolonged gastric, is excessive gastric emptying. So you look at all of these different things and making a judgment and a bias based on something that they don't know. So the interesting thing about all of this, Deb, when we talked prior, was I had asked you, as they are grilling you and asking you over and over and over and saying that the cannabis is causing your symptoms, you had asked a lot of the clinicians if they ever knew anything about the endocannabinoid system. And what was their answer?
My questions were, what do you know about cannabis? Nothing. What do you know about the endocannabinoid system? What are you talking about? The endocannabinoid system we have in our body that could be deficient. It's like an umbrella. It bathes all of our organ systems. And, as sick as I was, I tried to do a little bit of education. But they just looked at me with blank stares. They're still not getting education, Sherri. And I had a conversation with a nurse practitioner, or a student nurse practitioner that's almost finished. And I said, what they teach you about the endocannabinoid system? And he said, you're not going to believe this. Nothing. Still, Sherri.
I know. It's like,
How
it's
can
not
that
taught.
be?
I know. And this is why nurses, you hear me say in my videos, nurses are the game changers, right? Because why? Finally, nursing is catching up. In 2018, the National Council State Boards of Nursing, which is the nursing regulatory board that puts out the nursing exam for all nurses to get licensed in every state, they put a call to action that all nurses, nursing students, and advanced practice nurses must have 6 essential areas of knowledge when it comes to cannabis as medicine. Let that sink in, okay? So we are pushing. You're part of the American Cannabis Nurses Association, so am I. I'm part of Cannabis Nurses Network. You're part of the Holistic Caring Green Nurse community. And we are truly looking to advocate for nurses to be tested on their nursing boards on the endocannabinoid system. And here's the reason why. This is the simplest reason. If the endocannabinoid system is the largest neuroregulatory system in our body, if the endocannabinoid system regulates all 11 organ systems and all of the messenger signaling systems that give messages to our body, doesn't it make sense that we take care of that system first?
It controls all of them.
Right. Yeah.
I don't understand. I don't understand why it's not mandatory that every physician and every nurse immediately has to have education.
Yeah. I mean, it regardless of what your belief is, what your bias is, what your dissonance is, cannabis is here to stay. It's here to stay. The endocannabinoid system is real. There is research. It is time for health professionals to get with the program, truly to get with the program, because you will be your patient's hero. You will be making a difference. You will be helping patients reach a better quality of life, more so than all the pills and procedures. Like I said, I'm not anti-pills. I'm not anti-procedures. I'm about holistic integrative health, about complementary, about making it all work. Patients will come to us all the time and they'll ask us nurses, does this work? Does that work? Does this work? I go, it all works and none of it works. We have to figure out what works for you. We're all unique individuals. We all have endocannabinoid systems that function differently. Everything that we do or don't do in our lives affects the endocannabinoid system. So as clinicians, we need to know those things. We need to know to be able to teach our patients what activities that we may be prescribing or telling them to do that's supporting and not supporting that system. Because the last thing we want to do is clinicians is to make people feel worse, right? So this is what's happening. We are a society of pills and procedures and really truly not looking at root healing. We need to look at root healing.
And we also teach them how to boost their endocannabinoid system without cannabis.
Exactly right. Exactly right. I mean, it's just so interesting. how all the activities. So, if you've ever been to our website and you go check out our intake form, we got an 8-page intake form. Okay. So when we're consulting with patients, we have a very detailed intake form. And the reason why is the more information I have on you, the better we're able to hone in and target on what your specific needs are to make that plant medicine work better for you. So it's not just about cannabis. Cannabis is one piece of the pie. You'll hear me talk about that. Biopsychosocial spiritual healing. Cannabis works on all of our systems, works on mind, body, and spirit. However, we also need to implement other things in our activities of daily living and our care plans to make it work best. It's expensive. Cannabis is expensive, right?
Oh,
so what
my
we're trying,
goodness.
it is. So we want to keep the cost down. So if you can do specific activities that's going to make the cannabis work better and keep your costs down, that's amazing. The goal of cannabis as medicine is to take the least amount to get the most therapeutic effect below the threshold of being impaired. Now, don't get me wrong. I'm all for the elevated experience. There is nothing wrong with people feeling good.
Right.
And I talk about that all the time. And that's one of the things I'm going to be talking about at the conference coming up in September in a couple of weeks.
Right.
I'm going to be talking about spirituality as the root of cannabis care, the art and science of nursing, and how we as clinicians have a responsibility to really tap into different types of nursing theory as we work with ourselves, patients, and professionals as we push the needle forward towards legalization of cannabis.
Right.
Really,
Absolutely.
really important. Yeah.
Absolutely. And, we're talking about THC a lot, especially because I have cancer. But one of the things you recommended for me was CBD, CBN, CBG.
Yes,
And
you have a vaporizer there, right? The
yes,
trifecta vaporizer.
yes,
Yeah.
it's
So
amazing.
isn't it nice?
Yes.
So what it is, what's really good, so it's a trifecta. It's a combination of CBD, CBG, and CBN. And it's inhalation. And so the really great thing about that is you're getting multiple cannabinoids in your body at the same time. It's going to hit quick. It's non-impairing, and it supports and nourishes your endocannabinoid system. It hits those CB1 and CB2 receptors immediately. And so you're finding a huge benefit in using that.
Oh, absolutely. And, you and I talk about inhalation and, some people look at it negatively. And I think, it's the quickest way to get the medicine in your system.
It is. And I am a proponent of inhalation. I've been a huge stigma fighter because inhalation was the first method of administration that I did as medicine, and it
Right.
worked immediately. So really quickly, I'll just share my story. So I went over 18 pharmaceuticals. There was a nurse who was 70 years old who came to my home, and she was one of my energy healing clients. She had just retired and she wasn't able to get in touch with me. She came to my house with a joint and she looked at me and she goes, "Sherri, get with the program. Cannabis has been around, in Massachusetts, it was 2014. She says, cannabis has been around medically since 2012. It's probably going to be legal in Massachusetts soon." And then she says, "I have a little secret for you." She goes, "I'm 70 years old. I've been using cannabis every day since I was 17. I said, "What?" She's been using cannabis every day. So she goes, "Yeah, I take a little toke here and there." And she says, "I'm not on any pharmaceuticals and I've never been hospitalized." Now, granted, that's not for everyone, but I had to really look at that. And she also disclosed to me that her father was a pharmacist. And prior to 1937, he was carrying cannabis formulations in his pharmacy.
Yes.
She taught me that there were over 600 pharmaceutical preparations in pharmacies that had cannabis in it. That was a big shoe drop for me.
Isn't that wild?
Yeah. And so I inhaled. So she literally, here I am with a 70-year-old in my house. She's giving me a joint. The one inhale, I felt my head crack open. The second inhale, would say my head cracked open and consciousness poured in. I was just blown away. It was like the whole world changed. It was like the shade was lifted. And I relaxed the second puff. I relaxed the third puff. Pain was completely gone. And so on over 18 pharmaceuticals, and I started crying. I was like, "What? I can't believe this. Oh my God." And then I got mad. I got really mad because how many patients are out there that are sick and suffering where pharmaceuticals don't work? They're refractory to these. It's horrible. And so that's what propelled me on my journey. So inhalation, if it wasn't for that inhalation and that immediate effect that I had, I probably wouldn't have been so excited as I was then, because it happened a pain of 10 to a pain of 0 with 3 puffs in 10 minutes.
Right.
And so that's what propelled me to go forward and to learn and to figure out how to make it work for me so I could consume this in a way to come off my pharmaceuticals and to start living and to become a nurse again. So really, an inhalation was method. So when we talk about inhalation, we need to look at risk-benefit ratio, right?
Absolutely. That's what we do with all medications.
Right. And why are we inhaling? So if patients can't get in their oils or their capsules or their pills for nausea, vomiting, intractable nausea and vomiting, inhalation is really great, because what does it do, right? It works on serotonin receptors. It works on those CB1 receptors. It takes the anxiety down. It relieves the nausea so you can get in the tincture or the capsule or the gummy. Really, really great for nausea. Really great for anticipatory nausea. Great for PTSD flares. People that get triggered and that go into PTSD flares, they get hospitalized. PTSD is really serious and can be chronically debilitating. So when your patients feel triggered and they're going to go into that PTSD flare, what sometimes they dissociate. Cannabis inhalation can break that immediately.
Absolutely.
I've seen cannabis inhalation can stop suicidality immediately, stop that trigger immediately, remove nausea immediately, decrease pain immediately. But it's not the only thing we recommend patients to do. We love to teach stacking, multiple methods of administration using cannabis like you are. Not only do you inhale, but you do the oils, you do the vapes, you do topicals, right? So you've turned it into a lifestyle, a health and wellness lifestyle to keep you on the trajectory of healing.
Absolutely. I'm learning to cook with it. I'm learning to make smoothies with it. If I am gifted leaves where I can put the pure leaves and make juice with it, I do that. It's so healthy. Oh my goodness, Sherri, it changes our life.
It totally has changed our life. And so that's why we're here today, you all. We are here because we care. We are stigma fighters. We're here to decrease stigma around using this plant as medicine. Everyone should have a right to use it. It shouldn't be the last resort. It should be an option that's put on the table with all of the other options. Like I said, everything works and nothing works. We need to figure out what works for each individual patient.
Exactly right.
So Nurse Deb, you've been to a couple of conferences. I think you said you're going to try to make it to this next one that's coming up.
I am. I'm going to try.
Good. Excellent. So I'm going to promote it. So Nurse Heather, if you're out there, I am extremely honored to be one of the speakers at the Cannabis Nurses Network Conference in La Jolla, San Diego on September 1st and 2nd. I'm going to be there with a group of amazing nurses. All of these amazing nurses here are going to be presenting, and there's a lot more. But my topic is really near and dear to my heart. I've been working on this for a very, very long time. And part of the reason why I love this topic so much is because I'm going to narrow it into the art and science of nursing. High science and spirituality is the root of cannabis care. So really kind of tying in nursing theory, right? So as nurses, when we're looking at making something more recognizable, you have to look at multiple aspects of it. And nursing theory in school is very important. So we're going to look at Gene Watson's theory on human caring. We're going to tie it into spirituality as the root of cannabis care and the art and science of nursing. And so one of my big messages to nurses out there is, you nurses, all nurses, the art of nursing is you. Your heart is your art. Your art is information and how you work with patients to deliver the science and the information that you want to deliver to them. So really, really excited to be presenting. I'm going to be on a panel with Nurse Jamie. She's going to be talking about psychedelics.
Let's talk about that before we hang
we can
up.
We'll talk about that before we hang up. So psychedelics, we're going to be talking about hospice end of life care. And then Nurse Denise is going to be talking about energized living. Her presentation is on that, and her presentation really truly ties it all together as we end the day on activating your endocannabinoid system day. So it's going to really be a great high vibe event focusing on the future of nursing, which is truly going to be endocannabinoid system care. So we're really, really excited about that. So yeah, so before we jump off, let's get started a little bit on psychedelics, because I'm a psychedelic nurse. I haven't really, I've been working in psychedelics for a while now, past couple of years, one of the founding members of the International Association of Psychedelic Nurses. And I'm one of the nurses that's been trained for ketamine home therapy with Ketamelts, with Keta MD. And also we've been doing a lot of psilocybin retreats, and I would call real world evidence research, R&D on the side, having private little retreats with nurses and really taking and developing calls on how we can help patients tap into other plants for healing the brain chemistry, healing trauma, for post-traumatic growth and healing. And a lot of patients that are on medications that just don't work. So what has been your experience, Nurse Deb?
Well, mentor Nurse Sherri. So when I came home from this experience of being on a ventilator, I had something called PRESS, and it's where it was from all the seizures and convulsions, and I basically had a brain injury, and nothing was connecting. And you and I talked several times, and we talked about psilocybin and magic mushrooms, and nothing was coming back, Sherri. I wasn't able to connect things. I was still lost. I walked down the block and got lost. So we talked about microdosing of psilocybin, and I decided I have to do it. My neurologist didn't have any real thoughts for me. He just basically called me a marijuana user and broke my heart. But I don't know, Sherri. I just think I lost my train of thought. I'm sorry, Sugar.
Well, it's okay. It's all right, sweets. So listen, so psychedelics, really, so, you think about it, you were in a coma, you were shocked, you were without oxygen, right? So you have to figure you were in this state of trying to recover. And so, so you think about this, you were in the hospital, you weren't heard, your mental, emotional, spiritual needs weren't met at all, right? At all. They took care of you physically, but they also, you were placed in you were traumatized by being hospitalized. And so that takes a toll on our mental, emotional, spiritual health. So here we are going to hospital to get help. And what do? We get shamed. We get judged.
It was
you were
shame.
carrying that. You were carrying that with you when you got home, and you needed to process that. And it's often very, very hard to process emotion when you're in a state of what? Of crises. You can't solve problems from the same mindset that you're in them. And so in order for you to process emotion, you needed to step out of the story a little bit. And we needed to start to rewire your brain a little bit. And so psychedelics have been really, really powerful in being able to do that. Being able to create new dendrites in your brain, or neurogenesis, provide new brain cells. And so specific areas of your brain, neuroplasticity, the right side and the left side of your brain start to communicate, right? And so if you imagine, and you're not tripping when you're taking, so psychedelic microdosing is taking a low dose below the threshold of being impaired or hallucinating, right? And so it's very, very subtle. And they call it a neurotropic. It's a brain hack. It works on all of these different neurotransmitters, and it starts to connect the dots a little bit. So when you're in a space of trying to process emotion, you're processing emotion from a different space, because now why? You're able to look at things from different perspectives because your brain is starting to communicate, right? Is that some of the experience that you've had?
It is. And Sherri, I've talked to 2 or 3 other people that have been microdosing mushrooms who have had brain injuries as well. And they all said the same thing I said. I can feel the connections coming back together. I can feel them. I mean, how do you explain that? I don't know how to explain that. But you feel them going back together. And then the next day, things that you didn't know the day before. It's amazing.
So happy that you're having that great experience. It's just,
thank you, my love.
Boop. This is why I do what I do. It's really,
it's what I do, why I do. I have gotten, I'm much better. I'm not healed. But
well, the thing
I,
is, Deb, the thing is with healing, this is one of the things I love to say about healing. Healing isn't the absence of illness or disease. It's not, right? It's doing the best you can with what you have right here, right now. Doing the best you can so you can show up being the favorite version of yourself. And sometimes, and the best you can change moment for moment, right? And so that's what it is you're doing the best you can. And then your quality of life has improved. So it's not about, we were talking about this, Elizabeth and I were talking about this before, about medical diagnoses and nursing diagnoses, okay? Medical diagnoses are fixed. They're on a list and they never go away, okay? It'll even say history of cancer, even if the cancer goes into remission. So it's the medical diagnoses are there. Nursing diagnoses, on the other hand, change over time, right? Why do they change over time? Is because the patient's changing. We're constantly monitoring, evaluating,
always reevaluating.
yes, and switching it up and changing it up and teaching people about their smart body. So that's the part that's so interesting. So medical diagnoses are the same, nursing diagnoses change over time as we change, and healing isn't the absence of illness or disease. Healing is actually subjective to each patient. And as clinicians, we need to ask those questions. What's important to you? How do you want to live your life? What are things that you're willing or not willing to do? These are all the options. And these are the things that it could help with. These are the things it might help with. You might want to. So it's just providing all the information for patients to choose, right? Educating and empower patients to make choices that are best for them. And doing that under clinical guidance. We really truly have an obligation as clinicians to do better. We do.
I believe so. And, my neurologist is my friend, and I've had to fire him because my words were, what do you know about cannabis? Nothing. What do you know about the endocannabinoid system? Nothing. But I've talked to 2 other doctors, and my recommendation is you need to get off cannabis. I don't remember what the recommendation was. I kind of left his office crying. But it's, it's been very, very, very traumatic. And I will say that cannabis has been my lifeline. Inhalation helps with my anxiety tremendously. The CBD that I'm taking, that you also recommended, is making a world of difference. My vaporizer, everything makes a tiny little bit of difference. And as we know, with all medicine, it's trial and error. It doesn't matter whether it's pharmaceuticals or whether it's plant medicine. It's trial and error and figuring out what works for you and where your endocannabinoid system is and what do you need and what's your diagnosis and what medications are you on, and let's put this whole picture together and help you.
Absolutely. Deb, you're a miracle. I am so grateful that you came on to share your story. I know your story for sure is bringing hope to others. I know your story is going to inspire others, and I know your story is going to help other people grow and heal. So thank you so much for being on the show.
Don't
hang
Sherri.
up. Don't hang up yet. I'm just going to wrap it up here. Thank you for joining us. Next week, we're going to have on Dr. Blair. Dr. Blair is a very interesting man. I met him at the Cannabis Science Conference, or CanMed, or both. I've been to so many different, Patients at a Time. That was one of them. Met him at that one. So he was at a lot of these different conferences, and he's going to come on and talk about a product that he formulated that's called beta-caryophyllene drops. So beta-caryophyllene, as you all know, is a terpene and also a cannabinoid. So he's created this formula that we're going to talk about, and it's not cannabis derived, but it works on the endocannabinoid system and does very similar things. And the part that I love about it is this beta-caryophyllene liposomal drops actually are boosters. What we're seeing patients that are already using cannabis, that they're adding this into their regimen and they're not needing to increase their dosages, and sometimes their cannabis requirements decrease because the beta-carotene, and so they're saving money. So
wonderful.
Well, you know me, I'm all about anything that I can help a patient with, anything I can do to save patients money, I'm all about it. So beta-caryophyllene, and I have it right over there. Elizabeth and I have been taking it for the past 2 months, and I'm really kind of blown away about it. So that's why I want to share it. I think it's an important topic to share because not everyone wants to use cannabis. So if you can use a product that acts like a cannabinoid that's not from cannabis and it can have a therapeutic effect, awesome. If you're already using cannabis and you feel like your cannabis requirements are going up, beta caryophyllene, these liposomal drops can really be helpful and effective to make what you're doing better, so you don't have to increase your dosage. So really,
I look
good
forward
stuff.
to studying about that. Absolutely.
Yeah.
I was going to share one more thing.
Sure.
I felt well enough to work with a few patients, and I had a cancer patient that has had unbelievable relief and just been miserable for months and months for continued chemotherapy. And he's a new person. So he's watching tonight. I just wanted to
Oh,
give him
good.
a shout out.
Big shout out. And if he ever wants to come on and share his story, we'd love to have him on as well. We're
Great.
gonna, starting next year, we're gonna start a new show called Stigma Fighters. And it's really gonna be, like really quick little interviews with different patients that want to share their story, to overcome stigma and share their compelling story of healing. So very, very grateful that you came on, Nurse Deb. Don't hang up. I'm gonna wind this down with one last video. It's one of my favorite videos that I created last fall when I merged with Holistic Caring. And here we go. It is my high video. Here we go. Remember, everyone, it's about living your best life and helping others do the same.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses Group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.